My name is Brittany Craiglow. I'm a pediatric dermatologist and I practice in Connecticut. I'm on the adjunct faculty at Yale, and at MOPD and SBS I've been talking about alopecia areata largely, hair loss in adolescents, and also skin signs of systemic disease in kids.
What is your personal approach to developing a treatment plan with your patients and/or their caregivers?
There are a lot of things that we take into consideration when we think about a treatment plan. How old is the patient? How extensive is their hair loss? What have they tried in the past? So there really isn't a one-size-fits-all plan. So I think, always individualizing things, but often it really comes down to how much it's affecting the patient. And alopecia areata has a huge impact on a patient's quality of life. It's really, I would say, kind of impossible to interact with the world in a normal way when you don't have hair, you don't have eyebrows and eyelashes, and on the flip side, the world doesn't interact with you in a normal way either. So a lot of my treatment is sort of based on how the patient is doing and how much it bothers them, and I tend to be more aggressive in children who are having, a bigger impact on their quality of life.
Do you find yourself utilizing shared decision-making or other nuances to communicating with patients and caregivers?
For sure. I think we are a team, and my job, I think, is to give options and talk about risks and benefits of these different things, and also find out from patients and families what's most important to them. How risk tolerant or not are they? How do they feel about, certain regimens, taking medicine versus not? Really ultimately it is their decision and not mine, and my job is to just present the options.
You mainly treat pediatric and adolescent patients for hair loss in your clinical practice. Are there any specific nuances you'd like to share in regard to treating pediatric versus patients suffering from hair loss?
Yeah, I think, a lot of people with hair loss, especially alopecia areata, no matter how old they are, have been dismissed by healthcare providers as this is a cosmetic thing, it's just hair. Boys get told, oh, you can wear a hat, girls, you can wear a wig. And I think, one of our most important jobs, honestly, is just to acknowledge how hard it is and that it is a big deal, and kind of let families know that we get it. And I think for kids, we always want to make sure the treatment is not worse than the disease, right? And we want to make sure that we're treating the patient and not ourselves or the parent. And I think that comes into play with really, really young children. So, a 2-year-old who doesn't really know what's going on with their scalp, but their family's devastated because they don't have hair. Well, those are kids that, we may have to say, okay, we can try some things, but we don't want to, cause harm in the long run, right? So if the things we're doing right now don't work, then in a year or two, maybe we can explore something a little bit more aggressive when it starts to bother the patient more. And I think acknowledging that's hard, and I'll say, I know you want their hair back and I want their hair back, but right now we have to do what's best for them. But I think what's really great now is that there's so much hope for patients. We used to see those kids and it was sort of like, you talk about coping and there really wasn't much to offer, and we hope it grows back spontaneously. And now actually most of my patients, I can look at their families and with confidence say, like, I can get their hair back probably. If we need it by kindergarten, like, we can do it. That may require a fight with your insurance company and some risk tolerance, but there is hope in this way that there really hasn't been, which I think is really, really helpful.
Well, thank you for your time today, Dr. Craiglow. This was amazing. Is there anything else, any pearls that you would like to add?
We all sort of have this feeling when we see on our schedule a patient with hair loss, like, oh, this is going to take longer. Sometimes there are tears, and that can be stressful when you have a busy day. But I will say treating patients with hair loss is really super rewarding, and we all went into this field to help people, right? And I think there's nothing sort of like feeling like you made this huge contribution to a patient's life when they come back, and not only do they look totally different, but they feel totally different. And I also think that the landscape is really changing. So I think some of that feeling of, about a hair loss visit was because we didn't really have much to offer people. So it doesn't really feel good when you don't have options, but now all of a sudden we do. And so I think it is actually really fun and rewarding, and we just need to kind of embrace it and have an open mind, and people will, I think, find that it actually is quite fun.
Thank you so much.
Thank you.